Good morning, good afternoon, and good evening to our distinguished guests and participants from around the globe. I'm Kate Midden, Communications Director with the Global Health Advocacy Incubator, and I am thrilled to be hosting this discussion with my organization that brings together leaders across civil society, government, and philanthropy to discuss the journey to health program sustainability. Today we will hear from Bloomberg Philanthropies, who will talk about its international donorship and how it plans for the day when it is no longer the primary funder of the projects it supports. We will hear from a member of Tanzanian civil society, the executive director of an NGO, who successfully advocated for country ownership over maternal and reproductive health programming. And finally, we will hear from a government representative from Vietnam who will talk about how the way in which her government agency is planning for sustainability from the beginning. But first, I do want to go over a couple of quick logistics. We will be encouraging Q&A, so we do have that feature. Please send us your questions and also utilize the chat. I will mention that we got many excellent questions alongside the RSVPs, so we will be trying to get to as many of those as we can as well. Secondly, there will be translation for our distinguished guest from the government of Vietnam. So when Madame Ha is speaking, please feel free to use the interpretation feature, That is the globe-shaped icon, the bottom right-hand side of your screen. Just click English and that will bring on the interpretation. Just remember to turn it off when the Vice Minister is finished speaking. And finally, if you are following along online and following the conversation on Twitter, which we hope you are, please join the conversation by using hashtag #SustainSuccess and hashtag UNGA75, that is UNGA75. And for now, I would like to open us up with a short video.
At the Global Health Advocacy Incubator, we recognize that life-saving programs and policies are critical, but not enough. Locally led advocacy that plans for sustainability of financing and public support at the outset is key to ensuring that programs continue after international funding ends. In Tanzania, a woman dies every hour from complications of pregnancy or childbirth, often because she lives far from adequate services. Bloomberg Philanthropies, supported by HNBI Group, stepped in to support the government's vision of providing resources for high-quality maternal and reproductive health care to reach women where they live, even in the most remote areas. In Kigoma region, their focus area, maternal health indicators rose from among the poorest in the country to some of the best. Thanks to advocacy by health workers and the communities they serve, the government committed to maintaining the program, ensuring that this progress can be sustained. In Vietnam, 7 children die from drowning every day. With support from Bloomberg Philanthropies, the government's drowning prevention program saves lives by teaching children survival swimming and water safety skills based on proven interventions recommended by the World Health Organization. Based on the program's success, the government committed to expanding the project to reach half of the country's provinces. With the Global Health Advocacy Incubator as the sustainability partner, the program has been designed with a focus on sustainability from the start. The government is incorporating the program into its national commitments and investments, and support has been demonstrated across Vietnam through a quadrupling of local co-funding and leadership that is paving the way for the program's long-term viability. Locally led advocacy is the key to ensuring that health needs are met and sustained. Advocacy can ensure that public health receives the attention it deserves and that policymakers know it's a priority for their citizens. At the Global Health Advocacy Incubator, we believe the most important part of advocacy is the advocates. Local organizations, when equipped with the right resources and expertise to reach policymakers, are in the best position to drive a public health agenda that ensures healthier futures for their communities.
I would now like to invite 2 public health leaders to frame up today's conversation. We will start with Dr. Etienne Krug, the Director of the Department for Social Determinants of Health with the World Health Organization. Dr. Krug oversees the work and leads global efforts to help prevent death and injury, promote healthy aging, and address the social determinants of health. Dr. Krug, the digital floor is yours.
Thanks so much, and good afternoon or good morning to all of you, excellencies, ladies and gentlemen, dear colleagues. It's a pleasure to be here with you today to talk about what's a very important and often a complex topic. How do we transition from donor-supported projects to more longer-term sustainable initiatives? It is a challenge we all face. Of course, in an ideal world, there would be no need for donors, and governments would from the start be able to support all of the activities needed in their country. And in some places, this is the case. But in a very large majority of countries or cities, this is not the case yet. In fact, I think it's about 30% of countries do not have the funding for their health services today. So there is a lot of donor support still needed. And I think it's a good thing in a way, because donors have the possibility to invest in very important areas which otherwise probably would be neglected. I can think of some of the areas we just saw in the movie, like road safety or drowning, which kill for road safety 1.3 million, for drowning 300,000 people a year, and are often neglected because lack of understanding, lack of knowledge of the magnitude, lack of knowledge of the possibility for action. Thanks to donor investments like through Bloomberg Philanthropies, action is taking place in many countries. How do we make sure that this action is sustained and will continue beyond the initial investment and technical support is really the challenge we have, and what we will be discussing today. From our perspective, certainly it is by involving governments from the start and local civil society organizations, by making sure they're part of the conceptualization and design and carry out of the entire project, and that they are aware from the beginning and end date of this activity in order to gradually take it over. Capacity building is another important area, which I'm sure will be coming up. So all in all, I wish you a great discussion today. I look forward to listen to the speakers and learn from them about their perspective on how we do this best. I think we can still improve our efforts in this area, but certainly want to thank the Advocacy Incubator for organizing this discussion, because it is a topic that does require more attention, particularly in the very difficult circumstances our world is in right now, and with the challenges we have with the COVID response, as well as the economic downturn, which is looming in many, many different countries. So thanks very much, and have a great discussion.
Many thanks to you, Dr. Krug, for joining us. I know it is a busy UNGO week for you, and I think you framed this up beautifully, because I think throughout this conversation, we'll be hearing a lot about involvement of local governments and local civil society in the conceptualization and design of programming and the planning, and the importance of capacity building. So thank you for framing this up so nicely. I would now like to turn to Dr. Kelly Henning, who is the Director of Public Health Programs for Bloomberg Philanthropies. She is joining us by video to share some thoughts on this topic as well, before we turn to our distinguished panel.
Hello, it's great to be with you. Bloomberg Philanthropies brings proven solutions and a commitment to data for some of the world's toughest problems. Two of those problems are maternal deaths and child drowning. Birth should be a moment of celebration, yet about 300,000 women die from complications of pregnancy and childbirth every year, and at least 20 times that number suffer injury or an illness, often with lifelong consequences. Drowning is another preventable cause of death. 322,000 people die every year. 94% of those deaths occur in low and middle income countries. It's also a leading cause of death for children and young people all around the world. The video we just saw shows what we can accomplish when we work together. In Tanzania, the maternal and reproductive health program we supported prevented nearly 2,200 deaths and ensured that over 210,000 babies were delivered in upgraded health facilities with a skilled provider. Hundreds of healthcare providers were trained to provide high-quality obstetric and contraceptive care. We care about what happens to women and the communities of Tanzania long after our funding support concluded. No donor can be in any country forever, and that's why it's very critical to deliberate and to be thoughtful about handing the program back over to government and to ensure that it has a long-lasting life. At Bloomberg Philanthropies, we recognize the value and importance of partnering with in-country organizations and government agencies to ensure effectiveness and sustainability of all those programs that we support. For example, in Vietnam, we're partnering with the Ministry of Labor, Invalids, and Social Affairs to provide swim instruction for 6 to 15-year-olds throughout the country. The national government recently proposed scaling this program to other districts and other provinces. We also recognize the importance of strong collaboration, and we've experienced this with the ministry and implementing partners, the Global Health Advocacy Incubator and the Vietnam Office of the World Health Organization. In our maternal and reproductive health program in Tanzania, we worked in close collaboration with all levels of the Tanzanian government, ensuring that everything we did was aligned with their priorities and their plans. Our implementing partners were GHAI and Engender Health, and health outcomes were monitored by the U.S. Centers for Disease Control and Prevention. We also fully support advocacy to make effective and lasting changes. It's important to engage and convince both the public and policymakers why it's an issue that matters. One of the outcomes I'm most proud of from our work in Tanzania was the increase in facility-based deliveries, which went from 48% in 2011 to 85% in 2018, ensuring that mothers and babies had access to life-saving medical care in the event of an unexpected complication. That's a change in behaviors and norms that are essential to sustainability. One of the biggest lessons we've learned from these experiences is that sustainability has to be built into the programs from the very beginning. Partnerships and advocacy are essential. So is planning to ensure sustainability of the programs from the outset. Thank you so much for having me with you today.
At the Incubator, we are grateful for Dr. Henning's leadership and her experience and ongoing support. So now that we have had introductory remarks from these two leaders, I would now like to introduce our distinguished speakers. It is my honor to introduce Dr. Nguke Mwakatundu, who is the Executive Director of Tamini GHAI, a Tanzanian organization that works on maternal and reproductive health. We are also joined by the Honorable Wentai Ha, the Vice Minister of Labor and Social Affairs for the Government of Vietnam. Anuradha Kanal is the Regional Director for Southeast Asia with the Global Health Advocacy Incubator, my colleague. And later on, we will also be joined for the Q&A by Kelly Larson, who oversees drowning prevention, road safety, and the Partnership for Healthier Cities with Bloomberg Philanthropies. Dr. Nguke, I would like to start with you, please.
Thank you, Kate. Hello, everyone. Thank you for this opportunity. First, I would like to discuss the maternal reproductive health program in Tanzania itself. This program brought better healthcare to village level by upgrading and equipping its facilities and training non-physician clinicians. This approach increased women's access to emergency obstetric care, reproductive health services, and family planning. And we also strengthened the referral systems, improved the women's experience when giving birth through birth companionship, and increased demand for good quality services through multimedia communication campaigns and by partnering with community health workers. Improving care through this program meant strengthening the local capacity to provide care and build demand towards care. We helped to ensure that women visiting the facilities will be met with a trained provider. more than 400 health care providers and more than 190 community health workers were trained to provide care, including family planning and also build demand for care and provide education. But all those improvements required financing, and we are thankful that Bloomberg Philanthropies and Foundation HNB Group gave us the resources to do the program. But these improvements, after the program was coming to the end, needed to be sustained. And how do we going to sustain them? Thinking about how the program is going to be sustained, we needed the government to know that we as health workers, community members wanted the program to continue. And we needed to show its impact and show that we support it, and we would like to hold the leaders accountable to ensure that the quality of services that have been attained are maintained. So we thought it's important for the government to hear from their constituents, and for that we became advocates. And we are thankful that Bloomberg Philanthropies brought Global Health Advocacy Incubator as a sustainability partner to help us in advocacy with the government. And the Global Health Advocacy Incubator came in to help us to plan how we can be advocates and ensure that the program becomes sustainable. And they helped us to provide dedicated training and ongoing support to local implementers, the doctors and nurses to tell their stories to legislators and the media. And these frontline caretakers and partners were the people who were best positioned to tell the story of the program and make the case for dedicated government funding to keep the program running after the funding ended, donor funding ended. And they were the experts, and when they told their stories, the members of parliament, especially those from the region who are supporting Kigoma, they listened. And these members of parliament understood the impact of the program and the importance of the program, and themselves became champions in the parliament of Tanzania. Advocacy also includes sharing technical expertise, and we participated in trainings convened by the incubator to help healthcare facilities and district councils forecast their needs and prepare the maternal reproductive health specific budgets. Through our advocacy campaign, we also had high-level meetings with the key ministries, the vice presidents and the president's office. And these offices listened when we explained the needs and the impact of the program, and they themselves became champions for Kigoma. And this contributed to one of the program's greatest achievements, that the government allocated to Kigoma the highest number of health staff that were allocated in the country in 2018. On June 20th, 2019, we joined our partners along the national district dignitaries as the program was transitioned from the international donors to local stewardship. And thanks to our advocacy, the regional commissioner for Kigoma promised to sustain the activities and the high level quality services they provide into the future. And now we have continued following up, the promise being fulfilled. And so far, 1 year on, the activities that have been implementing these facilities are continuing to be implemented, and more women's lives are continuing to be saved. Thank you for listening.
And many thanks to you, Dr. Nguke. It's such an important piece of all of this, is you're talking about not just building political will to carry these programs forward, but really building political champions, and just the importance of advocacy in this whole journey. I would like to turn now to the Honorable Vice Minister of Vietnam, Madame Ha, please. We look forward to your remarks, and just as a reminder, if anyone needs an English translation of Madame Ha's Vietnamese remarks, please just hit the interpretation feature and hit English, and you will be able to hear.
Ladies and gentlemen, colleagues, I would like to send my best regards to all of you participating in the discussion today. At Melissa, we think that drowning is a silent killer. that has taken away many lives of children. And in Vietnam, every year we have more than 2,000 children killed by drowning every year. Therefore, the prevention of injury and drowning has always received the highest attention of the National Assembly, of the government, and of all ministries and agencies. And the Prime Minister has already launched the national program of injury prevention for children between 2016 and 2020. And in 2018, Molisa, along with Bloomberg Philanthropies, signed an MOU for 5 years to prevent injury and drowning for Vietnamese children. And I'm happy to inform you that the pilot period of 2018-2019, we have 9,000 children between 6 and 15 who have been trained with water, with swim skills, and more than 17,000 children have already taken the safety skill, water safety skills courses. And Vietnam has implemented in a comprehensive manner many drowning prevention programs, and we have already expanded cooperation with other stakeholders and international organizations, including the WHO, in order to prevent drowning. And we are also approaching the international standards in water safety skills and swim teaching programs for children, as well as completing legal frameworks as well and national programs of injury prevention. With those efforts, the situation in Vietnam has seen a lot of considerable improvement, and the death rate of children has gone down dramatically. And I would like to share with you some experiences in order to ensure the sustainability of the programs in Vietnam. And I would like to share 5 experiences that we have been doing in Vietnam. First, I agree with Dr. Etienne Krupp that the injury prevention, especially drowning, always needs the utmost attention of the government and other stakeholders in order to ensure the life, the rights to life of children, and to effectively implement the International Convention on the Rights of the Child, as well as the agenda of sustainable development. Secondly, I also agree with you about the importance of the projects supported by the Bloomberg Philanthropies, WHO, and Global Health Advocacy Incubator for partnering with us throughout the project. And I think injury prevention and drowning needs the attention of not only government leaders, but also National Assembly members. And luckily in Vietnam, we receive assistance and attention of the parliament, of the local government, and also of international organizations. And we also enhance the responsibilities of families, of schools, of local communities, civil society organizations, NGOs, in our joint efforts to prevent injury and drowning among children. Thirdly, we think that we need to further complete the legal framework for this effort, particularly specific legislations, policies, strategies, and national plan of actions until 2030 in our efforts to prevent injury and drowning. Fourthly, we also enhance the coordination, interagency coordination, in order to improve effectiveness of the projects, as well as private-public partnership, cooperation between local organizations and international organizations in order to harness resources and to effectively implement our projects in a sustainable and long-term manner. And we think this is a very important experience in order to ensure the sustainability of our project, as well as other relevant models that can be applied at the local level. And we have shared 8 best practice models to provinces. And I think that the intervention measures need to be based on scientific evidence, experiences of the international community, particularly the scientific support from the Bloomberg Philanthropies, the WHO and Global Health Advocacy Incubator, especially in terms of providing knowledge and skills for parents, for children, water safety skills, swim skills, and other intervention measures that help improve a safe environment for children, and to minimize the risk for children. Lastly, we think that the intervention measures need to be expanded and shared throughout the country, mobilizing local resources, community resources, in order to ensure sustainability of the project. We will also expand cooperation with other governments and international organizations. I think the experiences of Tanzania can be shared with Vietnam, and we can apply these experiences in preventing injury and drowning among children. And we also appreciate the assistance of the Bloomberg Philanthropies, of the Global Health Advocacy Incubator and the WHO. And we learn a lot from your experiences in order to effectively implement our program, particularly for the upcoming periods until 2030. Over the past time, our government, our National Assembly, always highly appreciate the support and help from your agencies, particularly in assisting our government in formulating national policies and national plan of actions of injury prevention and drowning prevention for the period of 2021-2030. So on this occasion, once again, allow me to express our sincere thanks to Bloomberg Philanthropies, to the WHO, to the Global Health Advocacy Incubator for your precious support in our efforts. and we are committed to continuing working with you in this very important program in order to save lives of children from drowning. Thank you for your attention.
And many thanks to you, Vice Minister, for these comments. I think you've really reminded everyone just how broad and multi-pronged, the endeavor to sustain success really is. You talked about everything from public-private partnerships to 8 different local models, collaboration, mobilizing domestic resources. It is a very broad issue that often comes down to the specific country, but also all of the different interventions for the intervention, if you will. I would now like to turn to Anuradha Kanal, my colleague, who is the Regional Director for Southeast Asia for the Global Health Advocacy Incubator. Anu, you come into this conversation with a unique lens, really supporting the advocacy in the policy development. So I will hand it over to you to share your perspective.
Thank you, Kate. Thank you for the question and for having me on the panel today. This is an issue that I'm incredibly passionate about, and I want to start off with appreciation for Bloomberg Philanthropies for investing in solutions to complex public health problems and also really caring about its continuity. The public health interventions that Madam Ha and Dr. Nguke talked about are innovative and have been incredibly successful in saving lives in Tanzania and in Vietnam. Advocacy is critical in building political will and public demand that are essential to sustaining and scaling that kind of progress. And we at the Global Health Advocacy Incubator identify and support local organizations to achieve these sustainability goals. About the maternal and reproductive health program, while the program was exceptional and donor support ran well over a decade, the decision of the funders to exit was met with a lot of resistance at different levels. Local leaders understood the importance of the program, but were not ready to completely own and fund the program. Approaching elections, budget shortfalls, and competing priorities all created inertia against country ownership. To continue these life-saving programs for moms and babies when private funding ended, broad political ownership, urgency, and public demand was needed. So we supported the partnership in developing and implementing a 3-year transition plan that was successful in securing budget and human resources to sustain the work. I will now highlight for you 3 essential things that got us there. Number 1, build advocates. We supported program implementers to recruit and to train advocates and identify and engage key decision makers. But it was the Tanzanian organizations that led the advocacy campaign and enlisted the community at large in support of the work. And this included program beneficiaries, their elected representatives, media, local government, and so on. This is what provided the political coverage that was necessary for the policymakers to come out in support of the program. Number 2, sell the program. Local advocates agreed on and articulated what the program had accomplished, what it would mean for the community to lose the services, and what exactly needed to happen to ensure that it continued. And those in the front line, like Dr. Nguke, were trained as spokesperson and of course did a brilliant job communicating to policymakers that donor funding was ending and that government was now responsible to continue the progress. Brilliant media stories, passionate public hearings made the program very real for decision makers and gave it the attention it deserved. Number 3, advocate for budget. A crucial first step was to map the budget process and identify key decision makers who could influence budget decisions. The partnership spent many hours figuring out what would it what it would cost to keep those services ongoing. Clear asks conveyed by the right people, aligned with government's vision, struck a chord, and government eventually committed to taking over the most essential of the pieces. Now onto the drowning prevention program, which is a stellar example of how advocacy for sustainability, when built into the program from the beginning, produces powerful impact and outcomes. I have distilled 3 key elements for the Vietnam work to share with you all. Number 1, integrate sustainability at the inception of the program. Transition to country ownership is stated as a core objective in the MOU between donor, implementing partner, and the government. With leadership from Madam Ha and Department of Child Affairs, the program has seen tremendous buy-in and a 4-fold increase in public financing from the time of initial engagement in 2018. Number 2, prioritize the transfer of expertise. Engagement of local and international experts as thought partners to the government has strengthened the transfer of skills to local implementers. This has also really helped integrate best practice interventions from the World Health Organization into key national strategies and budgets under consideration. And lastly, number 3, creatively position the issue. Media advocacy and excellent storytelling have made the need for drowning prevention and the solutions provided through the program very real. And this has helped build greater support for the program within the ministry, across government, with legislators, and most importantly, among parents and the community at large. So in summary, I just want to reiterate that advocacy is key to sustainability, and advocates exist both inside and outside of government, as demonstrated by our panel today. The plan to facilitate a transition of ownership from donors to local stakeholders, most importantly to governments in charge, needs to be considered at the outset. It needs to be inclusive, and it needs to be able to bring everyone along towards a shared vision. And with that, I will thank you, Kate, and pass it on back to you.
Thank you, Anu. You've done a beautiful job, as always, illustrating the importance of advocacy and the, a strong path forward in going about supporting advocacy. You talked about building advocates, selling the program, advocating for budget, all intensely important. And of course, the takeaways around integrating sustainability in the program early on. We heard that earlier from Dr. Krug as well, and also our other speakers. Introducing more knowledge transfer and the creative positioning. I mean, there's so many threads to really make health program sustainability successful. I would like to now transition us to the Q&A portion of our event. And this is where I would like to introduce Kelly Larson into the mix. First, we do have a question for the audience, and don't worry, this is an anonymous poll, but we were just curious to hear how many members of our audience are already thinking about health program sustainability in the earliest part of their program, if that is part of the planning. So the question, how often is sustainability considered in your organization's program planning and design? Always, sometimes, never. So please go ahead and weigh in, and we'll take a look at this in a bit. But first, I would like to turn to you, Kelly. Welcome. We are thrilled to have you. The burning question that I have is that Bloomberg Philanthropies is, of course, known for investing based on health outcomes, taking a very data-driven approach. Why advocacy as a focus for Bloomberg Philanthropies?
Well, thank you, Kate, and thank you to our panelists for a great conversation today. I'm really happy to participate in this virtual UNGA side event. At Bloomberg Philanthropies, we recognize that donor-funded programs are not scalable or sustainable without strong government partnerships. And both Dr. Krug and Dr. Henning mentioned the importance of government and high-level government buy-in and local participation from the very get-go. And I think when we hear from Madame Ha and Dr. Nguke, we were able to see the successful outcomes of those programs because of the local participation as well as the government commitment. Anu did a great job of really highlighting the importance of advocacy, and at Bloomberg Philanthropies, advocacy plays an essential role in all of our public health programs. It's one of many criteria that we look at for implementing strong public health programs in low and middle income countries around the world. But we also recognize that we must be data driven, which we know in Tanzania and in Vietnam, those programs are very data driven, and that we can implement evidence-based proven solutions that we know will definitely bring us positive outcomes. Advocacy, as Anu so nicely highlighted, really is essential to not only push government, but also to help create an awareness of the importance of whatever public health issue is being addressed in the country. And I think the examples in both Tanzania and Vietnam are really outstanding. Also, in just recognizing the importance of measuring and monitoring the outcomes of the program so that anytime we can either scale or shift priorities and strategies. But I think that one of the unique areas of support that Bloomberg Philanthropies provides is advocacy, and we recognize that that is the foundation of much of the work. And just want to thank Dr. Nguke and Madame Ha for their leadership in their programs in Tanzania and Vietnam. And I know I can speak on behalf of us at Bloomberg Philanthropy as we're very proud of the partnership. So thank you very much.
Thank you for that, Kelly. I would like to bring in Madame Ha to this part of the conversation, because when you're talking about working with governments about this great example of the work in Vietnam, Madame Ha had mentioned earlier on 9,000 children were taught to swim within the first 2 years of the pilot. That's a pretty extraordinary number. I'm curious to hear from you, Vice Minister, how does your ministry and the government overall decide, how do you build sustainability in from the beginning, and how do you prioritize, where you institutionalize the policies that lead to health program sustainability? What factors are most important in those considerations?
Thưa quý vị và các bạn, trong việc mà nói về cái tính bền vững của các cái chương trình y tế của chính phủ với cái vai trò tham mưu của cơ quan quản lý nhà nước và Bộ Lao động Thương binh Xã hội chúng tôi, thì cái đầu tiên là chúng tôi tham mưu cho chính phủ để ban hành các cái chính sách và có thể nói là có thể phổ quát để tất cả các cái bộ ngành có thể tham gia được. Như là chương trình đuối nước này thì chính phủ sẽ ban hành cái chương trình hành động và cái chương trình quốc gia phòng chống tai nạn thương tích cho cả giai đoạn 10 năm và cái chương trình phòng chống đuối nước, trong đó có các cái mục tiêu giảm thiểu cái đuối nước, tử vong do đuối nước. Và trên cơ sở đó thì Bộ sẽ làm việc với tất cả các cái bộ ngành ở cơ quan trung ương, và chúng tôi có phối hợp với 11 bộ ngành để triển khai cái chương trình này của chính phủ. Và chính vì vậy thì tất cả các bộ ngành đều triển khai chương trình của chính phủ tới các địa phương. Và chủ tịch ủy ban nhân dân các tỉnh, thành phố, có nghĩa là người đứng đầu các cơ quan hành chính của các địa phương sẽ phải vào cuộc để triển khai cái nội dung này. Chính vì vậy là nguồn lực có thể là ban đầu trong cái hỗ trợ cái xây dựng chính sách thì quỹ từ thiện Bloomberg, rồi quỹ vận động chính sách cũng như là tổ chức y tế thế giới hỗ trợ chúng tôi. Nhưng mà sau này khi đã ban hành chính sách rồi thì tất cả các cái nghị sĩ quốc hội, các đoàn đại biểu quốc hội sẽ cùng với các đại biểu hội đồng nhân dân các tỉnh thành phố sẽ quyết định các cái nguồn lực này để hỗ trợ thực hiện các chương trình của chính phủ. Và chúng tôi cho đây là yếu tố căn cơ nhất mà Bộ Lao động có thể tham mưu được với chính phủ để đảm bảo được cái tính bền vững của các cái chương trình y tế nói chung liên quan đến phòng chống tai nạn thương tích và đuối nước nói riêng. Thì chúng tôi nghĩ cái này là quan trọng nhất. Cái thứ hai là cái hệ thống về cán bộ của Bộ Lao động Thương binh Xã hội chúng tôi thì có hỗ trợ vào có một cái hệ thống về bảo trợ xã hội, trong đó có các nhân viên công tác xã hội ở các cái trung tâm bảo trợ xã hội, cùng với đó là cái đội ngũ cộng tác viên và cán bộ làm công tác trẻ em ở từ địa giới hành chính cấp xã phường lên cấp huyện, cấp tỉnh, và đây cũng là cái đội ngũ có thể triển khai các chương trình này. Như vậy là về chính sách, hệ thống pháp luật thì có, và về nguồn lực thì cả nguồn lực của các tổ chức quốc tế, các quỹ từ thiện, lẫn nguồn lực của chính phủ và các địa phương. Và thứ ba là hệ thống con người chúng tôi có để đảm bảo thực hiện cái này. Bên cạnh đó là thì chúng tôi có hệ thống các cái giáo viên là phụ trách trẻ em, phụ trách cho an toàn trẻ em, tư vấn tâm lý trẻ em, rồi phụ trách các cái hoạt động vui chơi trong trường và ngoài nhà trường cho trẻ em. Thì đây là cái lực lượng có thể tham gia vào các cái chương trình chiến lược của nhà nước, của chính phủ về y tế công cộng cũng như là cái phòng chống đuối nước. Như vậy có cả ba thứ: một là cái hệ thống về cơ chế chính sách, hai là về nguồn lực. Nguồn lực có cả nguồn lực của tổ chức quốc tế, nguồn lực của chính phủ, nguồn lực các địa phương và nguồn lực người dân. Và thứ ba là có hệ thống con người. Con người thì có hệ thống của là đội ngũ giáo viên ở các cái trường, đội ngũ cán bộ tại các cái xã phường, cộng đồng dân cư, và đội ngũ cán bộ của ngành lao động thương binh xã hội chúng tôi với tư cách là thành viên của chính phủ, cơ quan được chính phủ giao phụ trách cái nội dung này. Xin cảm ơn.
Thank you for those insights. I would like to turn to you, Dr. Nguke, because you have worked on this from the civil society side. Of course, public-private partnerships, advocacy, governments look very different in Vietnam than they do in Tanzania, but I would welcome your insights on approaching this from civil society based on what you've heard today. I also do want to mention that the results of our poll came in, and 59% of our participants said that, thank you, 59% of our participants said that sustainability is always considered, 41% said sometimes, and 0% said never. I expected the never category to be low, but I thought there might be a bold soul that might own up to that. But this is actually wonderful news that this is something that has become more ubiquitous in the global health space. So Dr. Nguke, I would welcome your reflections.
Sorry, Kate, can you repeat your question? I'm very sorry.
Yes, so we're talking about engagement between international funders and governments in terms of health program sustainability. Madame Ha talked about the importance not just of building it into the DNA of government, but also collaboration with civil society and local organizations and people. As the leader of a civil society organization who has done this, worked on the sustainability journey from the civil society side, I wonder if you have some thoughts about, or key lessons learned about how to navigate this relationship or the importance of that relationship from the local organization lens.
Okay, so thank you so much. I think in terms of advocacy from the civil society perspective, I think it's very important for civil society organization to first establish a good relationship with the government, and also to ensure that the work that is being done by the organization is well understood by the government, and you have measurable results that you can show the government what you are doing. And so that in that way you can show the importance of that program that you are working on. And that's the way you build the trust between yourself and the government, to see you as a trusted partner, someone who implements the program well, but also that your program matters, because the government has many priorities. So they have to find your program really matters, it really brings the impact, and they have to understand the way of how easily they can sustain it. So you have to have a good relationship, but also you have to be able to tell clearly the government what you have been doing and what the government can do in order to sustain it. So have some conversations with them, giving them the details of what you are doing to ensure the government really understands what it has to do to sustain. But also, it's important for you to have very good relationship with stakeholders, other stakeholders. I can say that, for example, for our case, healthcare providers, but also the communities, because those are the ones who really tell about this program. So if someone comes to ask, a member of parliament or a regional commissioner comes to ask, it is those communities that will say what is happening. So you have to have a very good relationship, but also ensure those communities get good services, but also they can really tell what these services are and the impact. So I can say for civil society, because we're in the middle between the government and the communities, it's best to build a good relationship with the government that way, but also ensure the communities understand what you are supporting, what you are doing, because all those factors will help the government to see what you're doing matters and maybe decide to fund the program that you are implementing after the donor funding ends.
Thank you. And I'm curious if you're willing to share, I mean, what you're saying about building good relationships with government, about being very clear about what the needs are, and building political will and political champions. That really is about facilitating the strength and reinforcing that relationship. When you are in the room with a government official that you need to talk to or sell on your program, or you need to build that kind of political will, are there specific areas that you focus on? Do you focus on, you know, the mortality rates? Do you focus on data? I'm curious if you would mind sharing a bit more about kind of the approach. I think there are a lot of organizations that would be curious to learn from you as someone who's been quite successful in building these relationships.
Okay, thank you. I think for the government, I would say you have to understand what are the things that the government would like to hear, to put it that way, because the politicians would like to see the people, maybe people's lives are being saved, maybe more children lives are being saved, or more children complications are being treated. That the government likes to hear what this is doing to the people. So you have to ensure that your communication really goes towards the impact that this program is having. Like maybe last year we saved maybe 200 women lives, or tell the stories about some women who had complications, in our case, who were saved by these projects. For example, we had the referral project, which we are using local communities to transport women to health facilities. And then we equip this, we strengthen this facility to provide the services. So if you give these stories of, for example, of a woman who had certain problems, and then once you had, through this program, maybe was bleeding at home, and through this program, her life was saved and would not have been saved because of, if this program were not there, and telling the story about how many more lives are being saved. So for politicians and the government, they like to hear these kinds of things that are tangible. And so if you could tell these tangible things, their ears become more open, and they like to know more about, okay, so what does this take? Because it comes to the cost. So if you want for the government to really take care of this cost, you have to show how big is the impact and how the population is impacted. And because the politicians would like the population to vote for them, and so they'll just be very interested to see the impact and ensure that this kind of program continues beyond the donors' funding.
Thank you very much for that. I think that is spot on and very, very helpful, and gets back to what Anuradha was talking about earlier, about creative positioning and storytelling and the different ways that you can get your message across, whether you're talking about the broader media landscape or for key stakeholders. Anuradha, I would love to bring you in. You've talked at length about the importance of advocacy, but in your role, you have a global purview overseeing a lot of countries that we work in Southeast Asia. I wonder if there are some takeaways that you have or lessons learned that you could draw kind of across the different countries in regards to some of this around creative positioning and advocating kind of to key stakeholders.
Sure, Kate, thank you for that. You know, whether it's Tanzania or whether it's Vietnam, we've used the same principles of advocacy. There are three fundamental things that you need to build on the ground The public has to be wildly supportive of the issue that you're working on. There has to be interest from policymakers, and that there needs to be a broad ownership of the issue, not just within government, but also within the public and the communities at large, and that there needs to be demand for services that are being provided through programs. So in order to ensure that programs are continued or policies are adopted, strong voices need to be heard. And like Dr. Nguke said, policymakers are looking at how does this impact their constituency? What is this going to do to the overall health of the population? They're also looking at how this positions themselves in a way that they can further the interest and the priorities of the country. So everything that we're doing, the stories that we're telling has to connect back to the agenda and the priorities at the country level. And this is what I mean by creative positioning and creative storytelling, is everything we did in Tanzania was aligned back to this is the priority of the government of Tanzania in reducing death of mothers and newborn babies. And in Vietnam, similarly, our colleagues who are sitting in the room are doing exceptional work in storytelling, in talking about why this is important and why Vietnam needs to prioritize it.
Thank you. And while I have you, we did get a question from the audience that I would like to open up. The question is from David, and he asks, are advocates now using the skills and approaches you provided to address other issues and problems that they care about? For example, and beyond the issues that we're just focused on, is it a priority for the program that this take place? Anu, would you like to weigh in on this one as well?
Sure, thank you, David, for that question. It's a very important one. And I want to first talk about, appropriations and budget advocacy is an annual process. Just like in the United States and many countries of the world, every year you do go and advocate with the government and with the budget committees for appropriations and funding. So in Tanzania and in Vietnam, the advocacy infrastructure that Bloomberg Philanthropies and we leave behind, hopefully, is able to secure the funding each year that these very important life-saving programs need. Getting back to the question about other important priorities in the community that may also be able to use some of these skills that are left behind. And I would say the answer to that is yes. We are leaving behind coalitions on the ground. We are leaving behind sort of an increased and strengthened capacity to tell story, to present data and facts, to do better budgeting and planning in terms of accommodating the services that were funded by private donors. So there is that capacity that, I think Kelly talked about earlier, that we're really focused on, and that stays in the community and is able to benefit the community at large when programs stop.
Thank you. Dr. Nguke, I saw you go off mute. Would you like to weigh in?
No, thank you.
Okay, so we have 2 minutes left, but I did want to open it up for one final question, as we are, of course, having the side event during the UN General Assembly. We are on Zoom. There is a pandemic. I am curious if anyone would like to weigh in on the impact that COVID-19 might be having on this journey, or might be shifting the landscape in some way. Perhaps Kelly, if you would like to weigh in, or Madame Ha, or Anu, Dr. Nguke. We have approximately 1 minute for this very big question, but would welcome your insights.
Thanks, Kate. I'll just very quickly say, obviously the pandemic has been a challenge for all of us and across all of the public health programs, with governments focusing so much on COVID-19. But I think at Bloomberg Philanthropies, we've been really encouraged by the continued advocacy and support for public health at large, and really appreciate the leadership of those on the ground organizations that have been developed through a number of different programs and efforts by both government and donors such as Bloomberg Philanthropies and our partners on the ground. So while we recognize we're in a 100-year pandemic, we recognize too that there are opportunities to continue our work.
Thank you so much, Kelly, for ending us on that hopeful note. We are at time, and I know that everyone is looking ahead to a busy day and a busy week. So I would like to thank our distinguished panelists, guests, and also our audience members. The recording of this event will be coming out within the next week or so. We will also be publishing a blog around it, and please continue to follow the conversation and join in at #SustainSuccess. Thank you and have a wonderful day.